material to get through. We will give it a few more minutes for people to get here. To tell you the truth, this is probably the most registrants we've ever seen for any of our meetings. So we understand that there's going to be a lot of questions. So we'll just give people a few more minutes to get here. Ding dong.
You can turn, I think, the in and out ding noises off. I don't know whether that's while it's started, but who started the meeting.
Excuse me. Mm-hmm. Excuse me. Hello.
Hello.
Hello. Hello.
Hi there. We're just waiting. Hi there. We are just waiting for the meeting, a few more people to get here, and we'll start the meeting in a few minutes. In the meantime, can I ask you to mute yourself, please?
Can I ask you a question?
Sure.
I have tried to access the meeting through another computer, but it says waiting for registration. It won't let me in.
Sure. So the links that everybody received are specific to their registration. So it may be the case that if you are trying to reuse a link on multiple computers, that it may not be letting you in. One thing I would say is, I mean, we are at capacity for this meeting inside our Zoom account.
It's okay. It's okay. No worry. We can listen. It's okay then. Thank
Okay.
you.
Thank you. Okay, I'm going to give it 2 more minutes and then we'll get started.
You just might find turning that sound off might help a little bit. I can't remember exactly.
I do not know where it is coming from at this point. I'll have to look at it some other time.
Yeah.
Okay, we're at 7:05. We have 109 participants here, and I would expect that we have some more that will be trickling in. Thank you very much for the advice with regards to turning off the chime. I cannot find the setting, even though I've been directed to it, so I will have to experiment with that a little bit later. So I apologize for not being able to turn off the entry chime right at this instant. This is one, so my name is Gordon Lau. I am the chair of DPAC, and it is unusual to have this many participants in any of our meetings, although it's perfectly understandable. This year has a lot of changes, and parents definitely have a lot of questions. There's been a lot of information that's been coming at all of us, and I'm really glad that we could have some VSB staff here to help answer some of the questions that have been posed. Amanda, could you start streaming, please? Okay. Thank you. So for our agenda tonight, it is a fairly full agenda. What we've done so far is welcome to all parents. Thank you very much for taking time out of your busy evenings to attend and learn a little bit about what's going on in the district as we start school. I want to thank staff and trustees for attending, and I will let Carmen Cho and Suzanne Hoffman both introduce themselves, and then the other trustees and staff that are here. The evening will be broken up into several sets of the questions that have been submitted to us. We've kind of grouped them together as best as we can. And we did receive a lot of questions. We've broken them into some general categories for us to answer. And we will also have staff from VCH here available to answer some of the health and safety questions. So again, welcome. I want to acknowledge that this meeting is being held on the traditional unceded territory of the Musqueam, Squamish, and Tsleil-Waututh nations. We are grateful to be able to work on their lands. This meeting right now is being live streamed, and we are also recording the meeting so that parents may be able to view it later. We did receive over 430 registrants, and we received over 150 questions. We've grouped the questions together and summarized them. Many of them had quite a lot of details, but we just kind of tried to summarize the salient points and put them into the slides. Even with the work that we did, we still have some 30 slides of questions, and we won't be asking the individual questions to be answered. I think we figured with the number of questions, it would be best if there was some exposition about some of the topics, for example, masks, and then making sure that that explanation covered some of the sample questions that we have on the slide decks. Please, if you're not already muted, please mute yourself. It's an unmanageable number of people to have everybody speaking. We will keep the chat open to hear concerns and feedback, but we won't be able to answer questions there. We've found that in our meetings, that's just a little bit distracting. For those of you that filled out questions for the meeting earlier, we have reopened the question form so that we can gather any follow-up questions. And what we're going to do with those follow-up questions is we're going to gather them and group them and try to have some of the more common ones answered at our upcoming executive meeting by staff. Again, there's a lot of us here, and I mean, these are our children, and it is certainly, I hate to use the word unprecedented, but again, it is an unprecedented time. It is a little bit of, it's a little bit of an unknown situation for all of us, and we are trying to do the right thing. But in chat and in anything you do, please do be respectful. Thank you. So I'd like to turn it over to Carmen Cho and just leave it to her to introduce herself and any of the other trustees that may be present.
Great, thank you very much, Gord. Good evening, everybody. As Gord said, my name is Carmen Cho, and I'm the Vice Chair of the School Board. I want to say thank you to DPAC for, again, allowing us this opportunity to connect with families and parents and give us an opportunity to hear directly from you and your questions. We do have a number of trustees on the call tonight, and I would like to take a moment to acknowledge them. We have Trustee Fraser, Trustee Gonzalez, Trustee Parrott, and Trustee Wong on the call. So over the summer, the situation has been evolving and staff have been working on the back to school plan. There have been many conversations with stakeholders, including DPAC, and we are very grateful for the collaboration and for the many hours that staff and stakeholders and DPAC members have put in. We do understand that there are a lot of emotions right now for families. So families are feeling anxious, they're excited, concerned, optimistic, and nervous. We do hope that this evening will help provide some answers that will help you better prepare for the start of the school year and allow you to have confidence that your children can return safely, or that if you choose an alternative option, that is what is right for your family. So again, I just want to say thank you, and I look forward to this evening.
Turn it over to Suzanne.
Thank you. I would echo everything Trustee Cho has said of appreciation and the hope for the intent of this evening to be able to answer questions that have been submitted to DPAC. And thank you, DPAC, for collating them into groups for us, because I know that was no small feat as you synthesize the questions coming in. With me in the room this evening are David Nelson, who is our Deputy Superintendent, Pedro da Silva, one of our Associate Superintendents, and Colette O'Reilly, our Director of Health and Safety, and our entire senior team actually helped provide answers to the questions along with other district staff. So what we are able to provide you with tonight was truly a collaborative effort on the part of staff. And at this time, Gord, I would like to introduce to the group Dr. Althea Hayden. She is the Medical Health Officer with the Vancouver Coastal Health, and she is the Vancouver School District's Medical Health Officer. And we were pleased to be able to have her join us this evening to answer some of the very specific questions on the health and safety. So Gord, I think you have organized it in such a way that her questions are first, and then we will turn it over to the staff for the rest of the questions.
Absolutely. So without further delay, let's just move forward. As I said, there are a lot of questions. So we're going to start with the health and safety questions. And what I'll do is, again, as I said, I don't intend to read every question out loud. What you see is the kind of, we've grouped all the questions, and I'm going to ask Althea to get started by just providing a summary of the recommendations for back to school with regards to physical distancing, masks, ventilation, and learning groups. These are topics we received a lot of questions about.
Okay, so I guess I'm just going to jump in with a really quick preamble. And I know this material has been covered in a lot of places, but I do think it's worth repeating that children really are at the lowest risk of complications from COVID-19. They're also at lower risk of getting COVID. And if they get COVID, they're at lower risk of transmitting COVID. This is particularly the case in children under the age of 12. So we all have these very set preconceived notions of kids as germ factories, germ spreaders. I know I blame just about every cold I get on my child, but with COVID, that's actually not the dynamic that's present in our society. And it takes a really active shift in our mindset to appreciate that that's actually true. And it has profound implications for the way that we approach safely running schools today. So I think a couple things that we're going to touch on really are physical distancing. I think this has become such a common part of the way that we think about the world. Physical distancing is a key component of keeping ourselves safe in a lot of different situations, but it is also important to note that it's not a requirement. So in many workplaces, people are not able to be physically distant from each other. That's okay. We just need to have controlled environments and regular sets of folks who we might be more physically close to. We want to reduce the overall number of contacts that we have in our lives. So that brings us to another piece, which is the learning groups. So we have our classes, but we also have created cohorts within schools, which you could think of as sort of like schools within schools, or I guess like Hogwarts academies, whatever you want to call it. Groups of people that are doing more of their activities together. And again, this is to further reduce that total level of mixing within the community. It reduces the chance that any illness is introduced into that group, and it also reduces the chance of widespread of illness if illness is introduced. So those are some of the key components. Other issues or other parts of the safety plan that are worth mentioning are ventilation. So, we know that well-ventilated spaces in general have less transmission. This is the reason that outdoors is generally safer than indoors. And the good news, I suppose, on one hand, is that older buildings in general have much better ventilated than newer buildings. They have much more air turnover. That's why the heat bills are so high. And many VSB buildings, by their historical, the age at which they were constructed, actually have really great air turnover. So this is an asset to us going into this school year. Masks take up a large part of the public conversation, but they really are a very small part of the overall COVID control strategy. Anytime we're relying on people to do a thing, especially small children to do a thing, it's going to happen less reliably. And so that can't be a core part of our strategy. We have incorporated masks into the school safety plans, specifically for older children in crowded spaces where physical distancing can't be maintained. But I think the public discourse often really focuses on masks when that doesn't reflect their true value to school safety. So I'm just transitioning into these questions really briefly. Would our recommendations change as new evidence emerges? Absolutely. I mean, I think that's the easiest question to answer. We've been having, our recommendations have shifted wildly since the beginning of this pandemic, from not knowing even what the infectious period or incubation period of this virus is all the way to today. And we're continuing to learn. So we're watching our neighbors in the Yukon who've already opened schools. We may make some recommendations based on even their experience, and as well as watching what happens across Canada, internationally. We're always striving to improve safety in schools. I think the only thing I haven't really commented on is, how is the current plan safe? I mean, I guess I would say, I think that the current plan uses many components, and they all together add up to what should be a safe plan. If we rely on any one piece by itself, we're doing a disservice to our students, our families. But I think that the series of measures in place, which involve physical changes, cleaning, administrative measures like staggering entry and exit times, those learning cohorts, the class sizes, as well as personal measures, which include masking in some settings, all add up to a very safe plan.
What would you say to parents that, and again, this is a really common comment, right? I mean, what we're being asked to do in schools is very different from what we're asked to do in other environments.
Mm-hmm. Yeah, I mean, I think that's right. So what we do in schools is different than what we do in other environments. And there's a number of reasons for that. So I think the key one that I really want to focus in on is that the nature of risk of acquisition of illness, transmission of illness, and of severe illness in children is not the same as in the rest of the population. So yes, it is different than in a restaurant, but it's not very different than, say, a daycare. We don't have experience running schools so much in COVID. We have limited experience. We have a lot of experience running daycares. There have been daycares operating this entire time, including daycares with school-aged children. And we have a great deal of experience as to what the actual risk of illness in those settings is. And we've had minimal introductions of COVID and minimal transmission of COVID in those settings.
Thank you. I'll just move on to the next slide. So we also received a lot of questions with regards to what exactly happens when somebody presents as sick at school. And I think some of that is part of, and some of that is, what if a child is sick? But then there are similar questions about what happens if, you know, somebody the child knows is sick, say somebody in their family. And you know, we've grouped these questions for you to answer right up front. But I think some of those short-term, some of the immediate actions are on the VSB, or at least that was my assumption when I built this deck. So I'll let you comment on that, or maybe there's
Sure. I mean, I'll comment on it. I mean, you know, I think the expectation in this brave new world is that your children, you shouldn't be sending your kid to school, even if they have mild symptoms. I think, you know, we're learning actually from our colleagues in the Yukon that, you know, having too strict a policy can actually be problematic for allowing kids to participate in school, and that we have to have a realistic plan for what allows a child to get back to school. The current guidance is that if your child has any symptoms, even mild symptoms, which are compatible with COVID and which are not better explained by another pre-existing condition, then they do need to be medically assessed, which would typically mean that they would need to get a test for COVID. And then they would also have to have their symptoms resolved before they'd be able to return to school. I think there's been a realization that that's not a practical plan. And I think there's been a lot of feedback from families that that may not be a practical plan. So I think it's being reconsidered, but that is absolutely the current guidance. And then I think there's a separate question about what happens if a child becomes sick at school. So that's related, but it's not quite the same. And perhaps that was getting into your question about the actions of the school.
That's right, the short-term actions.
Yeah. Would you like to comment on that? Or should I comment on that?
Could we give that to the VSB? Because I assume that's an operational issue.
Perfect.
All right, so this is David Nelson, Deputy Superintendent, and we have, and posted to our website, we have our detailed safety plan, or it's actually called our safety plan, safe work instructions and protocols. And in those, we provide a lot of details to our schools as to the steps and procedures they would take in the event that someone becomes ill during the school day. In short, it involves, if it's a staff member, having the staff member go home as soon as possible. And if they cannot go home right away, having them stay and wait in an isolated area. And the same with a student. We have rooms, a room dedicated in the school. If a student becomes ill during the day, they would wait in that room, and we would be contacting parents or guardians to pick them up as soon as possible. And then in terms of where it goes from there, we take our guidance directly from Vancouver Coastal Health, as they are the professionals in health and we are educators. So our role is to make sure staff and students are isolated until they can be picked up or leave the school.
Thank you. So just back to some of the rest of the bullets there. I mean, so it sounds like, you know, before a child could return, the symptoms would need to clear up, and they would also need to test negative, likely need to test negative for COVID. Sounds like the guidance there might change, but that's the current working instructions. Could you speak to the notification and the actions taken piece? Again, just focusing on right now, just focusing on the child.
Yeah, so I think the important thing here is maybe to just say that the process around notification is not specific to school. So it's the exact same process everywhere throughout our society. I think people don't always have a clear understanding of how this works, but for any test in the Vancouver Coastal Health region, all those test results actually come to my office. So I work with a team of people. They receive every positive and negative test performed on anyone who has an address in our region, or if the test was performed in our region. And that means we're receiving every single positive test. We follow up every single positive test. So if someone is going for testing, there is no action. There is no notification, and it's really not necessary. At this point, the probability that any child with mild symptoms going for testing would have COVID is frankly vanishingly small. And we are undertaking this process out of an abundance of caution. And it would cause an enormous amount of pointless worry to notify folks about every time another person had a mild cold-like illness or a mild tummy ache or fatigue and myalgias. I think the other important point that needs to be made is that all those medical results that are coming to my office, they're confidential. So we cannot disclose those results to anyone unless we have a valid reason, public health reason to do so. So there should be no expectation in schools, as in any other part of society, that you will be notified of anyone else's test results. What will happen is if an exposure occurs in school, which would mean if someone who goes to a school or was physically present at a school was infectious with COVID at the time that they were in school, and it was identified that people were exposed, those individuals will be notified that they were exposed. In many cases, that might mean an entire classroom would be notified of an exposure, but the folks who are not affected, the folks who are not exposed, should not have an expectation that they will be notified. You know, we are aware that there's a lot of anxiety and that there's a lot of, there's often a perception that that there is no medical privacy around communicable diseases, but I do want to just set that clear expectation that you aren't entitled to other people's test results.
Okay.
In terms of actions taken, I think it needs to be clear that we assess each of these situations uniquely, and our goal is always to protect the health and safety of those involved. So we err on the side of overaction, but we don't have a sort of algorithmic approach to this. So not all episodes will be equivalent. We will ensure that we promptly follow up to if people need to be sent home from school, to self-isolate, that will happen. If people just need to be assessed for symptoms and monitor, that will happen. If certain people need to be referred for testing, that will happen. But we don't have a very, like I said, a very clear algorithmic flow to it. We really do try to assess the risk in each exposure.
Okay, so it's not, so there's no hard and fast, so what I'm hearing is there's no hard and fast answer that you give where it's like, we're aware that there was an exposure in a classroom of, you know, 25 children. There's no hard and fast rule about what will happen there. It will be the case though that it might be self-monitor, it might be testing. Again, but you can't say with any certainty that it's like, okay, there's, you know, the other 24 people in this classroom are going to end up at home for 14 days. That you can't say that with any certainty, and that's not probably where you would go to start with.
Yeah, I mean, we take excluding children from school very seriously, so we would avoid sending an entire classroom home if we could. But if we need to send an entire classroom home, obviously we would take that step. If there was a real exposure in a classroom of 25 people, it's unlikely that we wouldn't be communicating with the entire group. I find that really, really improbable. We would be at that point, you know, communicating at the classroom level, but I don't want to commit to saying that we would send everyone home for 14 days because I don't think that that's true in every situation. And we do take very seriously the burden that it places on families if we send people home for 14 days and the toll that takes on children's education, in addition to wanting to balance the safety risk.
Okay. And the last bullet of that slide is basically the same sort of idea. So somebody in the student's family has, or a staff, or a staff bubble, right? In a student bubble or staff bubble, somebody in their bubble has absolutely tested positive. What are the actions? What are the actions there, both as far as, you know, assessment of the student? What happens? I mean, so imagine this is, you know, somebody's a student's mother or father is absolutely tested positive. What happens at the school classroom level?
Yeah, so at the level of that family, if the parent has tested positive for COVID, that child will need to stay home. And public health will be following that child. And if that child were to become also a case, then follow-up would begin at the level of the classroom. But a parent being positive would not result in any classroom follow-up unless that parent had also exposed people at the school.
Right. So it sounds like, that would be one of the reasons. I mean, I'm just, you know, connecting the dots here. I know that one of the VSB policies this year will be to avoid as many non-students on school grounds as possible, and so that would be one of the reasons there, right? So that if somebody
that is absolutely one of the reasons there. Yeah.
Okay. I think that probably makes sense, and we'll go on to the next slide. Where I'll click. And I'll get you to speak to this, and I know that some of this part is operational in nature, and so I'll let you answer first, Althea, and then I'll turn it over to the VSB.
Yeah. So, I mean, I think basically what the questions here boil down to is you have a personal, I guess, bubble, if you want to call it that, set of people that you interact with. And the set of people that you interact with spontaneously might not be the set of people that on some level you're being assigned to interact with through your school bubbles. And what is the consequence of that? And the simple answer is that, you know, it would be easier from a COVID control perspective if we forced everyone into these, I guess you could call them hermetically sealed cohorts that didn't interact with each other, but that would not work, right? That wouldn't work for any of our lives. We all have jobs, we all have families. And so we have to accept that there is, that the people who we interact with do not only interact with each other and with us, right? They have other people that are part of separate groups. And that's going to simply be the reality of life. We can do our best administratively to reduce the total overlap between different groups of people. And in your personal life, you can also make those same decisions, right? You can choose to reduce contact with groups of people to reduce the total number of people that your family's interacting with. I'm not sure that I'm maybe fully addressing the question, but that's the way I think about this. And from a practical perspective, maybe I'll send this over to VSB, and if people have additional elements they want me to comment on, I'm happy to do so.
Sure. I think, I'll just make a comment about that first bullet. I mean, again, you know, one of the examples given to us was somebody with two children at different schools, right? And they're obviously seeing children, they're obviously seeing separate cohorts. And, you know, the question is, well, what do I do at home? And it sounds to me like, you're trying to reduce the number of interactions at school, but I mean, you recognize that, as you said, you know, if you've got two kids, they're going to be in the same household together. And so that is just part of, that's part of the situation that we're having to accept. Is that?
Yeah, I think that's right. I mean, this effort to create learning groups it's meant to reduce risk. It's not meant to, as I said, put people in hermetically sealed bubbles. We've done a lot of work in healthcare, a variety of aspects of healthcare, to try and cohort staff. So to create groups of staff that only work at a single facility and only work with a single set of patients to reduce the total risk that a healthcare worker will expose vulnerable patients. But the reality is that healthcare workers are frequently married to healthcare workers. And we can't tell people to get a divorce, right? They work at two different facilities. and they get to keep working at 2 different facilities, and their daughter works at a different facility. You know, we do our best to reduce the risk. We take all the practical measures, and those make a tremendous difference. But we can't demand this kind of level of adherence that would really upend people's worlds further.
Okay. And I'm going to turn it over to the VSB. You had some comments on the learning cohorts, or the learning groups.
I did. Thank you, Gord. It's Suzanne. Yes, I wanted to reassure members of DPAC that this notion of cohorts within our school system is something that we have taken incredibly seriously and have been really thoughtful about the work and what that looks like operationally in our schools. And certainly when we look at our elementary schools and we hear that cohorts can go up to 60 in size, it is our intention as best we can to keep classes as their own learning cohorts so that we can really reduce the number of contacts that they have within the school. And similarly with the secondary model that we have developed, looking at when we have split those classes so that then when they interact with another class of 30, perhaps in that flex time group, again, the number of contacts and to assist with contact tracing should there be an outbreak in a school is just something that we have spent a lot of time really working through with our staff and with our principals and vice principals in our schools. And in the context of school age care programs referenced in the second bullet, that's another group that we have been reaching out to, and in our school sites where we know who our learning cohorts are, we will then do the best we can working with out of school care to say these are our cohorts and how can we try as best we can to sustain those through our after school or out of school care programs. So I just wanted to ensure, Gord, that I had the opportunity just to speak to cohort sizes.
Okay.
And then Gord, if I may, I know Althea is not on the call for the duration. I wondered if we could ask her to answer one more question, which we think as staff is probably best answered by Coastal Health. And Althea, I can read the question to you. It's from slide 17, which is, it's around wellness. And the question is, how will staff and children be checked to see if they are healthy enough to attend class? And in parentheses, it has temperature testing, wellness questions, travel questions. So if we can hand that one to you before you have to leave, that would be great. Thank you.
No, absolutely. So for those of you who spent a great deal of time reading the VSB, actually really detailed, really well written. I want to give you guys credit for a great safety plan. You would know that there is a daily health assessment form, and the expectation is that all staff and families will be performing a daily health assessment every single day and following the directions associated with that. So really, this comes down to this principle that even very mild symptoms and you shouldn't be at school. So I think many people have this notion of COVID as being an influenza-like illness, and that really misses the mark. The most predictive symptoms of COVID-19 are actually the combination of loss of sense of smell, fatigue, and loss of appetite. So it is quite common to have things like cough or other respiratory symptoms, but it's very important to remember that this is a real spectrum of illness, that we expect illness to be mild. And we are asking folks to have that very detailed and daily health assessment done.
Thank you. I think that's, as Suzanne said, kind of from a slide further ahead, but I think that was the last question that was specifically directed towards Vancouver Coastal. Many of the other questions that on the slides coming up also have to do with masks, ventilation, physical distancing, but they're about the operation, about how these things have been put into operation in the schools. Mm-hmm. So these will be questions best for the VSB staff.
Okay, so if you don't mind, I'm just going to editorialize very briefly, and then I will step off this call, and I really appreciate you allowing me to do that. I do just want everyone to keep in mind that yes, there are health risks associated with going to school. We can't promise anyone that there will be no COVID cases in schools, because schools are a reflection of the communities where they reside. So as cases rise in the population, if they are to rise in the population, that increases the risk in schools. And we can do everything in our power to reduce that risk, but we will not be able to completely eliminate it. I really have great faith that we've put a ton of work into coming up with a really meaningful safety plan. I realize it may not satisfy everyone, but I just would ask parents to consider the health risks of also not having kids in school. Kids need normalcy, they need routine. There have been very meaningful mental health consequences to having kids isolated out of school, reduced physical activity, an absence of play. So I think we need to consider the social emotional development and wellness of our children from a holistic perspective as we go into this school year. I know we're going to have a few bumps along the way, but my job is to be part of this. So I will be there whatever happens.
Thank you. Thank you very much.
Yeah, thank you very much.
So with that, I'll turn it over to the VSB. Again, we're still in the health and safety section. We do have a number of sections with regards to schools in general, elementary schools, secondary schools. So I will keep my comments brief and I'll turn it over to the VSB.
Thank you. We're going to start the first section with David Nelson, our Deputy Superintendent.
Hi, everyone. I'm going to broadly speak to, I know this is around physical distancing, so I think Dr. Hayden did a really good job of summarizing the approach taken in schools, which is we are creating these learning communities or cohorts. So within those cohorts, we will be asking students to obviously maximize physical distancing, but the strict 2-meter physical distancing is not an expectation nor a realistic expectation within the cohorts. We are focusing as a district on preparing our school facilities to welcome back all of our students, and where we really need to focus the attention on, and which schools are doing, is areas where you may have students from outside of cohorts or individuals outside of cohorts, where we need to control the movement and the flow of people. So places like hallways, entering and exiting of schools. So that's work that we're doing. I know there's a question about outdoor learning. We're definitely encouraging our teachers and our support staff to take advantage of the beautiful place in which we live and to get outdoors and be involved in outdoor learning as much as possible. That is something that the board as well is supportive of, and we are supportive of and encouraging our schools to think about how they can put in place plans to take advantage of outdoors. In terms of lunchtime, students at elementary will be eating lunch in their classrooms within their cohorts, because we are aware that putting students into a lunchroom, as we may have done in the past, would not be in compliance with the cohort sizes. And in our secondary schools, the schedule is developed so that there is no lunch break per se for secondary students. So there is no need within the schedule for secondary students to be eating within the school building. In fact, they will be leaving the building for lunch, and that'll be the exchange between their blocks. A plexiglass is something that will be explored for staff who have to work within multiple cohorts in instances like offices where there may be a number of individuals coming in and we're not able to maintain a 2-meter physical distance between the staff and the individuals. So a lot of physical distancing is about working with and teaching our students about staying their distance. We're focusing with our students on minimizing contact and as much as possible maximizing distance between one another. And that will be our focus in all of our schools, but in particular with our younger students who are more likely to engage in physical contact as part of natural play.
Okay. I'll just move on to the next slide then. Again, this is with regards to masks, which is also something they mentioned, BCH mentioned briefly.
Yeah, so Dr. Hayden, I think, covered a lot of this as well. I guess a couple of things I wanted to note here. So one is that I think most parents are aware that the district will be providing all staff and students with 2 reusable masks. The Board of Education did pass a motion on August 19th in which they are encouraging all staff and students to wear masks while at school. And I think Trustee Cho will maybe speak to that a bit later in this question. Staff and students in grades 6 to 12 will be required to wear masks when they're outside of their cohorts and in areas of high density like hallways where they're not able to maintain physical distancing between them and people who are not in their cohort. Staff who work across multiple learning groups or cohorts and cannot maintain physical distance will be required to wear a mask. Students and staff will be allowed to wear masks at all times should they choose. But I also want to be clear that no student will be required to wear a mask if they cannot and do not tolerate it. And very important, I think, for all of us, staff and students, that we follow the guidance of Vancouver Coastal Health at all times as a staff in relation to all types of PPE, including the usage of masks. And as Dr. Hayden noticed, the guidelines provided to schools and in our district plan are reflective of public health advice and guidance. So I'm going to turn over the question about the last bullet to Trustee Cho.
Great, thank you, David. So yes, the question, will the VSB consider making masks mandatory for all teachers and students? As David mentioned, the board did pass a motion at the August 19th special meeting about masks. And the wording is to encourage the use of masks by all students and staff in schools at all times. So that is what the board has would like to see going forward, and that's the motion that was passed. So making masks mandatory at this point is not under consideration from a board perspective. I think we want to also say is when you think about the current policy, which speaks to the mask usage for grades 6 to 12 in areas where physical distancing cannot be maintained, one of the things to consider is that for younger children, it does increase the likelihood of them touching their faces or that they might need assistance putting masks on or taking masks off, which would require closer contact. So I think those are some of the reasons why in the younger years as well, it would not be recommended for children to wear masks. So as David said, we certainly think that the district purchasing masks too for staff and students does speak to the board's intent to encourage mask use because we all want to keep each other safe, but no one would be pressured or coerced into wearing one if that is not their choice.
Thank you. Just moving on to the next, there are quite a few questions also about ventilation in schools.
So again, David Nelson here. I know it's a bit hard to see me back here, but I'm going to do my best to address the questions. I have a lot of technical information that I'm not going to share at this time, but in summary, I want to stress a couple of things. Dr. Hayden spoke about the older schools and the airflow and ventilation and the advantages of some of our older schools in that regard. In terms of some of the specific questions about HVAC systems, all filters in our VSB HVAC systems were changed this summer. They are changed regularly throughout the school year. We have asked all of our engineering and custodial staff to ensure that our air exchanges are set to increase the amount of that the systems are set to increase the amount of air exchange, and in fact to increase the amount of outdoor air being brought into our schools. This will maximize the airflow within our schools, and in addition to that, the board has asked that, as part of their motion on August 19th, has asked that windows in classrooms be opened. And we have had our maintenance staff out in schools ensuring that windows can open in our classrooms to allow for fresh air to come into those classroom spaces. And in addition to that, as we were just speaking about previously, we're encouraging staff to get outside with students as much as possible. when the weather permits, so that we're teaching and learning in the outdoors.
Thank you. Also, questions that are related to health and safety, operational, bathrooms, and hand washing. A lot of big variety of questions about cleaning and bathrooms.
Yeah, so first I want to report that one of the things the district has been focused on for the last number of months has been upgrading faucets in our school washrooms. As we approach the return of students, we will have achieved quite a monumental task of replacing all the faucets in all of our elementary school washrooms. The vast majority of our secondaries have also been done, and we're continuing to work on them, but we have ensured that in every single secondary washroom in every single school, we've at least replaced 2 of the faucets within each of those washrooms. These faucets are the ones that are one touch and they stay on, so you don't have to keep retouching them, so you can properly soap and wash your hands in the washrooms. Although our washrooms will continue to have hand blowers, we also have paper towels available, and we'll continue to have paper towels available in washrooms. Our washrooms are cleaned regularly throughout the day. Our on-site custodial and engineering staff do an amazing job of checking in on washrooms and cleaning them throughout the day as needed. In addition, though, at a minimum, all washrooms will be cleaned and disinfected twice a day. Each school, there's a question about social distancing, and I think the question is number of students that might be in washrooms, and this is part of the reason and part of the, when we looked at our secondary schools, by having students come in the block schedule that we have, and by reducing the number of students in the building at any one time, we've really taken away in the secondary school that period of time where students are wandering in the halls or in our schools. And so that will help control our usage of washrooms. In elementary schools, we are structuring our breaks and are scheduling around things like recess and lunch. So we will be looking on a school by school basis to ensure that students are not just in hallways and wandering around in schools. In fact, they will be in classrooms or supervised during recess or lunch breaks. So we have systems in place to ensure that washrooms will not become crowded during the day. And so the last question about breaks. So again, at elementary, hand washing and hand sanitizing will be integrated into the program. It is part of what we will be teaching students. So there will be ample opportunity. And in fact, hand washing will be need to be structured into the day. And students will need to be given time to wash their hands. Again, in our secondary, the scheduling is done such that there is no pressure on students. They will come in for a class and they will have ample time between their flex period or their afternoon class, if they're in one, to make sure they can effectively and appropriately wash their hands.
Thank you. I'm going to move on to the next question that is actually for the trustees with regards to advocacy and with regards to health and safety. So over to you, Carmen.
Great, thank you, Gord. So I think the first one we already addressed in terms of our trustees able to impact the rules for mask use. We did pass a motion at the August 19th meeting that spoke to that. So yes, trustees can impact those rules. The second question about additional funding, I would say that, the board regularly advocates to the ministry for funding, whether it's per pupil funding or other matters. In June, we did submit our budget submission, and we requested funding for COVID-related impacts on school district operations. So that request has already been submitted. But I just want to assure people that absolutely, yes, we will continue our conversations with the ministry, and we will always advocate for the needs of our district as the situation changes and if we see that there's a need for more funding from the provincial government.
Thank you. Okay, so we're at the end of the health and safety section, and we're going to, the next section is with regards to the school restart. The first question is with regards to technology.
Good evening, everybody. I'm Pedro de Silva. Just maybe I'll try to address this question. I know this has been the question around a parent portal has been something that was asked back in the spring. We have been in contact with Microsoft just to look at how we can best connect parents in this environment. Currently, there is something called a Parent Weekly Digest that we're looking into that will give parents and the student's summary of activities on a weekly basis, and that will email their primary email address. So we're working on to get that rolling. The second part of it is around the streaming of classes. I think, again, I mean, we just got into a pandemic in June. A lot of teachers are learning to use the platform. And as we are providing some more Pro-D and people are becoming more comfortable to using, I think that this will become an even more popular way to use supplemental resources in class. When I see that online streaming classes, I kind of envision that. I hope that doesn't mean that there's somebody in a classroom talking for 8 hours a day and streaming. I think that really, as we're moving forward in the new curriculum, the more realistic thing is that teachers are using that to learn how to do videos in small chunks to supplement and provide communication things and work on course delivery. But it is the #1 topic that educators want help with. So I'm assuming that this will be something that will be improved as the school year goes on.
Okay. So the next question is with regards to standardized testing. So pardon me,
Thank
sorry.
you. Okay. When the question comes up about standardized testing, I'm assuming that you are referring to provincial assessments that take place. And currently there are 3 sets of provincial assessments. 2 of them are the graduation learning years, which is grades 10, 11, and 12. One is a literacy assessment and one is a numeracy assessment. And those are graduation requirements that students would have to complete them in either grades 10, 11, or 12. And certainly those have, the dates for those assessments have been sent out to school districts already. So from the provincial government, those tests or assessments will continue. The other provincial assessment is the FSA, the one conducted in grades 4 and 7. And ministry staff have indicated that they will continue and that they plan on extending the window of the assessment, which takes place in the fall. So yes.
Thank you. We also had a number of questions about substitute teachers. They will be, if it's not the regular classroom teacher, they will be moving likely from cohort to cohort. So if you could address those questions.
Thank you. So a lot of work has been done for TTOCs, which are substitute teachers, and employees on call, which might be the learning assistants, support staff, or perhaps custodial staff that go from school to school. And we're appreciative of being able to work collaboratively with our HR department and the unions in this regard. And our intention is to divide the district into quadrants to minimize the amount of movement that support staff that are on call would have around the district. So we would lessen their footprint. We've also talked about going down to families of schools. So one secondary school and a number of elementary schools being the schools that they would support or cover for. And also that also can reduce the amount of travel time, the travel distances that some of our staff would have to take if we could accommodate them close to where they live. So a great attention to this, and there's lots of detail that we are working through. Also, when a teacher goes into a classroom, the desks are now been situated at the front of the room with a 2-meter distance away from the class so that, again, that physical distance is in place. So if someone is coming from a different school, there is a physical space between that person and the students that are in the classroom. With respect to the second bullet, I will say that, again, our Employee Services Department has been diligently working on continuing to hire staff for the VSB, additional custodians, additional support staff for schools, teachers, administrators, at all levels of our system. We have been continuing to hire staff, and so we will have a good number of TOCs available for when our staff do call in ill, because there is a great chance that we will have more. But we do have support staff and teaching staff that have been hired as employees on call.
Would you say our numbers, the number of TTOCs that we have is likely greater than we did have last year?
I don't know that number off the top of my head. I know that I have physically distanced and welcomed groups of brand new teachers to the district and had a physically distanced lunch with them, and they are energetic and keen and quite happy to be a part of the VSB. But I can't comment on the numbers. I apologize, Gord, I don't know.
Okay, thank you. And this one, and this question here really spoke to personal assessment of risk and some individual choices. Could you address the comfort around risk?
I can. I think what the way I wanted to answer this question is just to express the confidence that I have in staff in schools to be highly sensitive to young people that are coming back into schools that are not feeling comfortable. And we know we need to be sensitive to students and how they are doing, and that we also need to be mindful of how our children, our students in schools are feeling. We are taking lots of opportunities to provide resources and information around mental health of staff and students and social and emotional needs of the children within our schools. And I must applaud many of our staff already who are providing professional development in this regard. There are a number of series next week. Again, just in light of being in the middle of a pandemic, having that thoughtfulness of the young people that we serve. And I would say that if there was a case of a child that didn't want to do PE because of the face mask, that with the teacher and the school and the staff within the school, they would take care of that child, because I just think there will be a heightened sensitivity to being thoughtful about the children in the school.
Thank you. There are a number, I think the header of this one is mislabeled. This is really about learning in the school setting and what will happen if students need to miss a number of days because they're in isolation or in quarantine.
So one of the requirements, as you may have already heard, is that we would ask all of our students to be on Teams right away in September. So everybody will belong to their class in the Teams environment, and we would put everybody in right as the start of school. And for those that are doing the transition option, they would also be in a team that is paralleled with the classroom in which they're enrolled if they're an elementary school student. So students that then are away because they need to isolate or perhaps they are ill would still have access to these lessons that were being provided to the class so that they continue to have the educational material that the remainder of the class would have. Much like we would do if we were not in a pandemic, we would provide the material so that students can keep up as best they can whilst they are away from school. And we feel confident with the Teams environment that we are able to support students remotely if they have to be away from school. With respect to the number of sick days, again, that's like any other school year. Students need to stay home for the duration of how long they are sick. And in some cases, it may be a few days, and in others, it is longer. And we will work with the family to support as best we can during any illness, COVID or not, that a child might experience.
Yeah, that second one was, there were some concerns expressed that if a child missed too many days due to isolation, that they might be failed out of a course.
In the context of secondary, again, as we would currently with our secondary students, continue to support them, have access through the counselor and any other resources that we can provide at the school level to ensure that any learning gaps are filled as best we can.
Thank you. Can you comment on some of the social concerns, both about children testing positive and also some of the equity issues with regards to some parents being less able to stay at home with their children, or being less able to support their children if their children are at home?
Certainly, we have had, since the announcement came on July 29th, a number of meetings with our administrators, our principals and our vice principals. And really, equity is one of the themes that we have addressed on those calls with our leadership within our schools. And certainly we are, we want to ensure that we are mindful of the needs of all of our students. And in some of our schools, we know that there are greater needs than others already. And certainly we have additional resources that are in place in those schools that would continue to support anybody who was struggling and perhaps unable to be at school and then would struggle in their home environment. So certainly reaching out through our counselors, through MCFD, if there's additional resources that we can provide there to support children that need to stay home because of illness. And again, with parents that are affected, we understand that, and that's true whether we are in COVID or not. But again, the thoughtfulness and mindfulness and through our principals are really talking to them about building a culture of care within their schools, a culture of integrity, and a culture of support for families as we go through these times, because they are unique and different. And we certainly need to do all that we can. And that wraparound of care that we provide for our students will continue during this time to support our learners.
Thank you. The next questions are around the stages of the startup plan and whether or not there is any possibility of localized changes.
So certainly we are in stage 2, and some of the differences from what we had in June to now. Previously, we were in a stage where we had density in place, and so we reduced the density in schools. And now in stage 2, the expectation is that all of our students are back in schools for our elementary schools and in our secondary schools. So there are no density targets in the current system. And also we have the idea of learning cohorts so that we are able to contact trace should there be an outbreak in any one of our schools. And when we looked at stage 4, previously that was fully remote that took place prior to June, which was partial return to school. And so there are differences in what the model is like, what it is like was like in June, and we have implemented the new model as laid out with the Ministry of Education, and it can be found on their website if families haven't had a chance to look at it yet.
Sorry, what does that mean for I mean, will the VSB act as a whole, like all schools will be at the same stage at the same time, or can one school be possibly at a different stage?
Certainly right now, the Ministry of Education has indicated that we are in stage 2, and that's the direction we follow as a school district as a whole. If there was to be a case perhaps where there might be an outbreak in a certain part of the district or in a school, under the direction of Vancouver Coastal Health or the provincial health officer, there may be some changes to that. But right now, the model is the same across the entire school district.
Thank you. Moving on to questions specific to the elementary. There are a lot of questions about immunocompromised students and what their options are. So if you could speak to available options for those students.
So there are 4 options right now within the district that can be considered. One is full-time attendance in school, obviously. The other one is the option for families should they choose to homeschool. There is also the transition option that has become available. And the other option that could be used for those students that are immunocompromised would be the hospital homebound program, which is something that you can read more about on our website. But really that takes care of youth that have specific illnesses and that they need to be away from school for that reason. And they have the option then of signing up and having support where we will provide a teacher that comes and supports and works with them on whatever it is that their class is learning. It is a very specific program for a specific group of students within the district, and there is a process and a procedure that we need to follow to register students for that program. But certainly it is an option that families can consider if they have children that are immunocompromised. And I know for others that have family members that are immunocompromised, looking at the transition option as a place to go in the short term so that they can look to enter school when things change with respect to COVID or when they feel that they are more comfortable having children to return to schools.
The transition program is something, the transition program is something that communications just recently came out about. And so there were probably a lot of questions about the information that was released. Can you kind of speak to the program in general? And you can see some of the questions about the details right here.
Yeah, so again, David Nelson here. Happy to speak to the transition program. Maybe I'll start just by clarifying that the transition program, or the learning from home I've got my last name.
Program,
Learning from home transition program is a kindergarten to grade 7 program. Specifically, it is not. It's not in place for secondary. The other options that Superintendent Hoffman spoke about were all for secondary, but this is specifically for elementary schools. So this option was developed in response to what we were hearing from families about concerns about not quite being ready yet for their children to return to in-person instruction, wanting to see how things unfolded, wanting to feel more comfortable about where things land within our system. So it really is intended as a temporary transition option, the learning from home option. Students in this option will be assigned to a classroom within the school where they're currently enrolled, and they will have their space held in both the classroom and in the school for the duration of the transition program. This means that students attending in person for the at least the initial phase of the transition program, while families who have chosen that are learning from home, will have fewer in-person students in their class. And it means that families who choose this option have the option of keeping their child's spot in a school and in a classroom for when they are ready to have their children return. Families that choose this option, we've been very clear in the information, and I do want to direct everyone who's interested to the VSB website under COVID resources, because there you'll find a fact sheet, an infographic that explains all of the options, and a video that specifically speaks in more detail about this transition option for parents, as well as the letter that went out. So anyone wanting more, please refer to that, to our website. But families who do choose this option are choosing it because they do intend to have their child return to school this school year. This is not a program. It is not something that is intended to run for the duration of the school year, but rather it is intended to give families some time to feel more comfortable and to make a transition back into school. So the parents who choose this program will be required to provide regular educational support for their child at home. And specifically what the families can expect is that assignments will be posted and provided for families. But again, parents choosing this option will be responsible for supporting their child's learning. This is not, we've been very clear, an online learning program. Students will not be receiving lessons online. Rather, they will be receiving check-ins from a member of the school staff. So our teachers in the schools and our support staff will be working together to figure out how best to check in with the students who are learning from home. Specifically, a couple of things then, I think I've covered all of them, is almost all of them, is that lessons and schoolwork will not be exactly the same. In fact, it is a program where the assignments and work will be posted for students and check-ins will be provided, but it will not be online learning. It is intended that this program lasts until December 18th. We have, and we do acknowledge that things can change. And so as a district, we will reevaluate that prior to December 18th to determine if that in fact continues to be the end date for the transition program. We have 3 re-entry points for students to retransition into schools, 1 in October, 1 in November, and 1 on January 5th. And we will be asking families in the program to indicate in advance of those dates if they are ready to move back into the program. And this is intended as a transition program from home learning to school. So it will not go the other way. We will not have students starting in person and moving into the transition option. So families who are not quite sure or are not quite ready, they may want to consider starting with the transition program and then making the decision to move to in-person learning. So I think I've covered all the questions on that slide.
Okay, there probably are more questions about the transition program. Just on the
I think
next.
there's some on the next slide, Gord. So
yeah,
2 more slides.
Okay, so this option is available to students in a choice program. Student space will be held in the program where they're currently enrolled, if that is a choice program or a catchment school or a cross-boundary placement that they're in and have been already accepted into. So regardless, the school they're currently enrolled is where their space will be held. We have provided information though specific to families in a Mandarin or a French immersion program, that because this is not online learning and it is not an online instructional program, that if they are choosing this program as a family, they will need to take responsibility for ensuring their children's language skills are continued to be developed to support them in being able to rejoin the class. We do not have the ability to support the second language skills through this option. And in terms of the transition opportunities, we will be on a school-by-school basis determining opportunities for children who are in this program to come into short duration, possibly outdoor type activities as they are preparing to return to school, because we recognize that it would be very helpful for both families and for children that are in this option to not go from not attending at all to attending full time. So there would be outreach and opportunities to maybe come and join an outside activity or come and participate in a story opportunity or to come and have an opportunity to borrow a book from the library. So there's a number of things we'll be looking at. It's not going to be the same in every single school. On our initial survey, we found there was quite an amount of variation among school communities as to interest in this option. So we anticipate in some schools there will be very, very few students in this option, and others there may be a significant number, potentially as many as 30% of students. So how this will look in different schools will depend on the size of the school and the number of students who are involved in the transition option.
Okay. The next slide is more questions about the transition, specifically for students needing additional supports, but it also does have a question with regards to the homebound program, which you mentioned, which has some specific requirements around it. Can you speak to those?
So just one additional comment to the slide that David just mentioned around the transition program for the orientation, that if you are in the transition option, that you would not need to attend the orientation that will take place on the first week of school. I'm not sure if you said that or not, but that would not be a requirement if you were in the transition program. We would do a separate orientation for that group of students. So thank you. Yes, the next one on the first point there, the hospital homebound, generally students that are requiring that program do have a medical note, and there's a process that we work through at the district to have students register and enroll in that particular program. In supporting students with diverse abilities, the support that they would have in the classroom with a resource teacher or an educational assistant would continue to be in place if they were a part of the transition option. So we would work with the schools, with the teaching staff and the support staff at the school to support the goals of their IEP in the transition option.
With regards to the, just going back to the transition, comparing the transition option to the homebound program, I mean, can you talk about a little bit about the education delivery in both of those options?
Can you speak from your firsthand experience? I can speak from
In terms of the hospital
Yeah.
homebound?
in Vancouver?
Yes, so the hospital homebound program, we have teachers that are assigned to that program, and traditionally, obviously, it's not the same. In COVID, they would arrange and meet up. We meet a student potentially at a library or public space for maybe an hour, maybe 2 hours if possible a week, and work would be provided, and that hospital homebound teacher really would connect with the child and just sort of help for that period of time with work and assignments. So the transition program in some ways is quite a bit similar. The difference being that we, in this one, are opening it up broader. We're not requiring children to have a medical note, because in the hospital homebound program, of course, the students continue to be enrolled in their school and in their community. And work continues to be provided by their regular classroom teacher, and they are supported by a hospital homebound teacher. So this, the transition program mirrors it quite a bit in that assignments would be provided by the enrolling teacher. The enrolling teacher won't necessarily be doing the check-ins at the school, but there would be someone from the school-based staff who would be doing check-ins, again, just to see how students are doing, likely with this class as a whole through our Teams platform would be how this will work. So there's a lot of similarities, I would say, between the two, but the biggest distinction is we heard from parents they wanted an option if they weren't comfortable. And the hospital homebound program really is for students with very specific medical needs that mean they cannot return to school.
I think another part of that too is our staff is starting to come back into schools now. So as those teachers start up their work, their programming, they will be reaching out to families as well. So that will happen in the week ahead.
Thank you. Also with the elementary restart, I mean, it's a bit of a comparison to the secondary. There were a number of questions about why more steps aren't being taken to reduce class size. And I think I managed to get the question about the orientation on this slide. So there might be one extra for you to answer here, but could you speak to, again, the idea of reducing class sizes or a hybrid model to reduce the number of children in class?
Right, so definitely we are following, the stage 2 guidelines as set out by the Ministry of Education. And I know that there has been lots of conversation from the BCTF with respect to the reducing of class sizes. So we're live to that conversation that is taking place. Certainly one of the things by offering the transition option, there may be some reduced class sizes because of the number of children that will be taking that option. And it is our commitment as a district to keep those in the transition option connected to their teacher and to their school. So that may be a natural occurrence that takes place, not in all, but in some of our schools. And when we talk about is there the ability to implement a hybrid model for a certain school community, one of the feedback pieces that we heard from a few of our different stakeholders or partners is that the consistency of programming across schools was really important. So don't do something different in one school or the other. And so as we worked through the plans for our secondary schools with our administrators and our teachers unions, we went for the consistency of programming, and then similarly at our elementary school. And again, following what it is that we have from the Ministry of Education around what does stage 2 look like, and that's the plan that we have been following. And then David, I don't know if you're able to speak about what the orientation day will look like. I don't know that detail yet.
Yeah, so our schools are currently working on plans for the orientation day in terms of both what it will involve. Our district will be providing guidelines around the information that needs to be covered for students as part of the orientation, but the timing of that will depend on the school. As I'm sure parents can appreciate, one of the things we do have in this district is as much as we have a consistency of programs, we have a large diversity of school sizes. So how an orientation will look in an annex of 4 divisions versus a large elementary school or a large secondary school will look quite different. So information will be coming out directly from schools to families around plans for orientation of students.
Thank you. Some of the next questions are to do with childcare for essential workers. And there we go.
Right, so as a school district, oh, that's the,
Oh, sorry.
that's okay.
There you go.
Thank you. Yeah, so the district does not run any childcare programs, but we work really closely with work with service providers to lease space in our schools. And certainly that conversation is ongoing at both the district level and at the school level as well. And I would encourage any parents that are wondering about that first week of school and what the options are to really work with their childcare provider that is within the school. We are not, as a school district, freezing any spaces in schools because we don't operate the childcare. We rent it, and if they are looking for additional space on occasion, we certainly try to work with them to see what we can do to accommodate. If there are challenges with childcare, what we would recommend is that any parents contact the West Coast Childcare Center, which is run through the City of Vancouver, and they can help assist with placement of children into any childcare that parents might be looking for. When it asks if we can take care of any children the week of the 8th and the 9th has all of our staff returning to schools, and our priority for those 2 days is the health and safety committees, the walkthroughs of schools, the putting all of the protocols into place that need to be, and providing our staff with time to plan for the school year. So we do not have any childcare operating during that week as a school district.
So they would need to find childcare for that week.
Right, and we would encourage them to go to the West Coast Child Care Center through the City of Vancouver to look for placement.
Thank you. This is the last slide on the elementary section before we move to secondary, and it's just a question with regards to operationally whether children would move from classroom to classroom.
So questions such as this are great questions, and thank you to parents for asking about it. Certainly now, as we've formulated what our plan is going to start looking like at the district level, we are operationalizing that at a school. So every school now is looking at their own unique circumstances to see what programs they have in place, what they have done in the past, what can continue to work, and what will need to change. And I know they are being incredibly thoughtful about that and need to have those conversations with their teachers when they return and those health and safety checks start to take place at the school level. So the answer to that is that it would be very site specific. But in hearing from our principals and members of our team who are working with schools right now, the plan is to minimize any movement of students from class to class and look more at moving teachers, because again, then they can physically distance at the front of the room rather than having students go around. And with all of the health and safety around cleaning, we want to make sure that our bubbles stay pretty tight within the classrooms and trying to keep classrooms to their own bubble physically.
Thank you. As we move on to the secondary restart questions, the very first question in the secondary deck is echoes the one in the elementary deck, but as you mentioned earlier, the options open to secondary students are probably a little bit different from elementary students. So again, could you speak to options available for immunocompromised students at the secondary school level and what they have for remote learning?
So maybe I'll speak to that. I think just going through the list of questions, maybe I'm just going to give a bit of context that the way that we kind of planned out the secondary delivery in stage 2 is that we really focused a lot on the health and safety and keeping kids connected to their schools. It was a really big priority. We had, our principals, our unions, we had DPAC and parent representatives. There was a real urgency to keep kids connected to the schools. So with this model, what if there are students that have medical conditions or they have situations that are unsafe for them to school, we have asked parents to contact the counselors to see what kind of educational plan that we can deliver. And the nice part about the secondary one is that it is based on a hybrid model, which means that teachers will have their courses organized in a team environment. And the students will come in and rotate face-to-face with a remote option. This will allow also for that flexibility to bring people in as they transition when they can. Again, trying to continue, as was mentioned earlier by the health authority, that it's really important for students to come to school for their emotional and their, their well-being. I think that one of the questions around remote options, so the secondary model is based on student choices, and when your students are returning to school, the quarterly model is still based on the choices that they requested and the staffing. VLN was also based on student choices. So those are the options for students. And we're actually really proud of the fact that we maintain student choice through the secondary model. So it should accommodate most students' requests. If students are sick, again, as was mentioned earlier, the elementary one, because teachers will have time to develop their courses through flex time and connect with kids in remote, that students who are sick should be able to keep up with course material as they go through a quarter.
So I just want to try to sum up some of what I heard there. So the core of the secondary offering is trying to maintain student choice, and so for students with medical conditions, I mean, you'd ask them to speak to the school, but I mean, some of those choices they might choose to make are taking more courses through VLN. Does that sound? Is that a reasonable summary? And then, yep.
Yes, so I would say that what we're asking and what principals and schools are doing is they're going to reach out to families and try to support them to stay connected to the schools and take courses at the school. And be flexible with that transition that comes back for students that come back. So when there's a question around a transition option, our hybrid model actually has a philosophy that we're going to try to, transition kids at their own pace. We want kids back in school, but there is a flexibility to look at each student's educational plan and try to, encourage them to come back. But we understand some of our students can't do that. So our schools are going to try to accommodate them and keep them connected to their courses at their school level.
And again, is that likely to be, and again, that could be through a Teams sort of thing, or?
Yeah, so all of the teachers will have, all the courses will be on Teams, and the students will be operating in that Teams environment and also coming face-to-face. But for those students that can't come face-to-face, they could participate in the Teams environment with the teacher.
And that would that be a little bit of live streaming?
Well, I think that would be what the teacher would do. I think that part of the flex time will be for teachers to connect with students who are remote. But if parents, the reality is, remember that teachers are also teaching all day. So there will be a time for them to flex time to connect with the remote learners.
Thank you. We have some questions about the amount of instructions. The amount of instruction that especially secondary students will receive. And we have some questions further on also about grade 12 students in particular and applications to universities. So could we start by talking about the just the amount of instruction that students will receive per day or quarter?
Yeah, so when the ministry announced their plan on July 29th, and they asked districts to provide a learning environment, an educational plan, or services for students. Right now in the model we have, students will get just under 9 hours of direct face-to-face time. And they'll get 3 contact times of remote learning during flex time. And part of this was, of course, because we wanted to create as healthy, focus on health and safety and creating environments that allowed for as much physical distance, allowed for staggered entries, And that was kind of the priority that we and other districts are doing when they're going to a quarterly model. I think every district is running into this. And I think the language from the ministry is that, you know, we are looking at educational plans for each student, acknowledging that it's very different. And it was a plan that was approved by the Ministry of Education, similar to other districts.
Thank you. Just moving on to schedules, can you speak to?
Yes.
Yeah.
Go ahead, Gordon, sorry.
Oh, it's just the slide ahead of you. I mean, we had some concerns about the high school experience. I mean, some courses are, you know, fairly academic and, you know, that fit well into the hybrid model, that half-day instruction and half-day remote. But, you know, there are some questions about the richness of the high school experience.
Right. Yeah. So one of the things that, you know, we did focus in on is trying to keep the student choice as a big priority. So, you know, our electives are still based on the kids' course requests from last June. Our staffing is still related to that. So we really wanted to allow for a diversity of educational experiences. And this is really important to us, right? And so we're also very aware of, and it was mentioned earlier again, about the impact of, you know, caring about the kids, their social, emotional, their connection to aspects of school that are really important to them. There are students that, you know, their only positive connection could be to a sport or to an elective, and they really find enjoyment in that. So we're trying to provide as much options for our kids to stay connected to schools in a safe way. So, and I would say this, you know, part of going to a hybrid model was that we wanted to maintain elective options for our students. It was a big part of decision-making along with the health and safety part. So we're hopeful that the schools will work through and figure out how to deliver these courses. This is something that we worked out at the school level, but we are pretty confident that we are going to have a wide range of elective options for our students.
And some of those electives will be in that course A, course B outline, and some of those other ones might end up in the flex.
Yes, and that's correct. So they will, those are school decisions about where they go. And, you know, I think that will be managed at the school level.
Thank you. Some more questions about the schedule and about flex time specifically.
Right. So one of the flex time was designed for a variety of reasons, but predominantly it was an opportunity for schools to support students, particularly vulnerable students that need additional support, and also to look at program-specific courses. The key thing about flex time is they also have to be very aware of the cohorts because we do have 15 students coming, but we also want to make sure they stay within the 120. And I think one of the things that everyone is discovering in the learning group thing is that when you start to combine a bunch of courses, you can get to more than 120 pretty quickly. And so we created this flex time. One is to give schools greater opportunity to support learners who need it the most, and also to keep programs that are best suited to not follow a quarterly model. The conversation around band, like I mentioned earlier, is one of those elective courses, and schools will determine whether they will fall in the quarterly or they'll go into flex time. We have asked schools if they can to physically distance the students. In flex time, they're split in half, so schools do have the option to split the kids in half if they would like to do that. But again, just like in the previous conversation, you know, we are really encouraged that students will continue to provide elective options for the students.
Just going back to that first bullet there, I mean, is it fair to say though that, you know, flex time will absolutely increase the, I mean, it really does increase the overlap between the learning groups. But I mean, the learning groups are on the small side, you know, you're trying to have 15 students in a classroom at a given time anyways. So by starting with the 15, you're still able to use the flex time in a creative manner, but it does increase the overlap.
It does increase the overlap, but as you mentioned, Gordon, when we did our modeling originally, this was a big driver to split the classes in half to help schools provide, options for kids in flex time. And we're pretty confident that we'll stay well in 120. We are getting flex time schedules from schools, and we are going to look over them as a district. And I do think that they will fall well under that. And we just wanted to ensure that and put our schools in the best position to be able to support the learners, not worrying so much about the, increasing and going over the learning group numbers.
Is it always, with regards to the flex time, is the flex time always lined up with is the flex time always going to be, I think that's where the middle bullet is the flex time always going to be lined up with their in-person course, or?
So we have asked school-based administrators to hand timetable and to try to keep those two sessions connected. So they're going to do the best they can to do that. And if there is sometimes where that doesn't happen, then they will have to provide a space in the school that's physically distanced where students can, they can do their work on their remote learning classes.
Thank you. The next question is about transcripts and for grade 12s and university applications.
So one of the things, having been in the Ministry of Education, is knowing how closely they work with the Ministry of Advanced Education, Skills and Trades. So certainly when we were going through the spring and with students transitioning to post-secondary, there was lots of work that took place across not only British Columbia, where our own ministry is able to liaise with post-secondary institutions, but nationally and internationally. And so once we are back started up in schools, I'm confident that those conversations will re-emerge, because all students, as they are finishing and they are applying for post-secondary, will have their pre-registration take place in January, and then the final course marks are submitted later in the school year. So the processes that will take place will ensure that students are not jeopardized in their admission to post-secondary, but there will be more details coming out on that. But certainly that happened in the last school year and will continue to happen again. And for the second part around ensuring grad classes not being unfairly compromised, the vast majority, not all, but most of the school districts in British Columbia have now gone to a quarter model. Some districts have gone down to one course at a time. I'm not sure how many districts there are that have done that, but we are in a quarter system right now. And certainly the work that we did is very aligned with other metro school districts. So we liaised very closely with others to see what it was that they were doing and how we could align the work so that the experience across districts was somewhat similar. All being said, there's unique programming that takes place in every school district, and certainly in Vancouver, we do have lots of programs in our secondary schools. So we came up with the model we did to ensure that those programs will continue to run throughout the school year.
What I heard from you with regards to the university applications is that that's an ongoing conversation with the Ministry of Advanced Education, and I know it's just a little bit outside, but I mean, just for those, do you have any idea what those conversations might look like, even at a national or even in the, well, I don't necessarily seeing students that excited about going to the United States right now, but I mean, are those conversations also happening at levels beside just our province? And is there any way to comment for those students that might be applying to a school back east?
Absolutely. When my time in the Ministry of Education, I was aware firsthand as we were redesigning the curriculum that those conversations are able to take place naturally. There are networks that exist in post-secondary institutions across Canada and beyond, and the conversations happen at that level.
Thank you. Right now, one of the requirements for graduation is volunteer hours, and it's a little bit not impossible, but fairly difficult for children to get volunteer hours right now. Has there been any thought about some changes at the provincial level or some advocacy with regards to changes?
Yeah, so I think that we're definitely going to look into this. I mean, volunteer hours is part of the career program, is part of the graduation. It's something that we're going to look at. I can almost assure you that your children are not going to be penalized through a pandemic because of this. And I think that we'll work through some communication around this in the future to see how it works, whether it'll be done through the teacher in a different type of way, or whether there'll be some conversations with the ministry. But I mean, it's unrealistic, I think, to assume that we can do this and that there will be some communication coming out around this. So.
Thank you. Sorry. We have some questions around diverse learners, and both at the elementary and the secondary level. The ministry has stated through their operational guidelines has made some requirements around the supports available. So can you comment on how those supports will be made available in a timely manner?
Yeah, so I think that maybe from my perspective, I'm just going to try to give some confidence to parents who have, children with diverse needs that, I'm continuously just amazed at how much discussion is here around these students and other vulnerable students. We have two directors of instruction, Erin Davis and Allison Ogden, who constantly meet with the learning division team with Meta Hamaguchi and Jody Langlois around not only the district programs, which have kids cohorted in schedules, but also the students that are integrated into other classrooms. And we're daily talking about how we can ensure that these students are taken care of. I would say that in school, the staffing still remains. The experience for the support will exist. There'll be a resource teacher. And I would encourage parents, if they have concerns about IEPs or anything related to a support for their children, to contact the counselors and the schools. But I can tell you that I have a lot of confidence that we are really trying to support, move courses around. If you feel that a course would be better suited, talk to your counselor, and I'm sure they will work to try to accommodate your child.
If students or diverse learners need some accommodations, for specific courses, will they be given any priority to juggle their schedules?
I think that I would always encourage parents to talk to the counselors to go over the education plan and to see what they can do to try to shift courses around that. I do think in schools, we always try to prioritize all students, but in particularly, we do want to ensure that diverse learners have all of the courses that can make them as successful as possible. But I would really send that back and communicate that through the school level.
Thank you. And just another question with regards to diverse learners, especially in this case in the life skills program, and how they'll be kept safe and healthy.
Yeah, so I think the majority of our life skill programs are in cohorts, and they will operate in a very traditional linear model with their teachers in a very controlled environment. So in terms of those students that are in programs, they will still be in the same type of environment they were in the past. As regards to the second part, we have received a lot of the flex options, and I think that we have asked schools to put study skills blocks in flex so that they are staggered throughout the year. So I think that will be pretty consistent through the schools to support the students.
Thank you. We are getting to just miscellaneous questions and close to the end of our evening, so I'll just move on to those. Parents are really receiving quite a lot of information from both their schools and the VSB and the news. If you were addressing, a parent at a local school, where would you suggest the first, knowing that our attention is limited, where's the first place you would advise them to listen to for information relevant to their child?
So on our district website, we are trying to keep that as up to date as possible with all of our latest information on health and safety, with the plans, the letters, frequently asked questions. There's some infographics, there's some fact sheets. So I would really encourage you to look at our district website, and then as schools start to roll their plans out, the direct communications that are coming out from schools to families about their child's programming.
Okay. I'm not sure where this question about the PIN number came in, but I assume it's required for some of the forms that parents are being asked to fill out. Is there somewhere they could discover that information?
So PIN number is a personal education number, and for sure, the school would be able to provide you with your child's PIN number.
Okay. And then there was a question with regards to the newly announced federal funds. Do we have any inkling of what the guidance with regards to those funds will be, what they might be used for?
We're waiting further clarification from the ministry, so that certainly lots of ideas out there as to what it could be spent on, for sure. But we need some direction from the ministry on when and how we can spend it.
And of interest to a lot of PACs, I mean, PACs have fundraised for their communities for both technology and playgrounds and extracurriculars. And there's some real questions as to how that might continue this year. Could you speak to how fundraising might occur and whether activities such as hot lunch would be allowed?
So yes, absolutely. I would encourage you to take a look at our health and safety protocol plan. And on page 28, there's an entire page on the parameters around food programs in schools. And that gives you, I think, the clarity, lots of clarity on what the guidance is around those for schools.
Can I add to that? We have been receiving this information as in addition to what's in the guide. We've been receiving questions from principals. We are asking principals to work with their PACs and to just hold on these. Although we've laid out the guidelines, I think we would really like to hold on the hot lunch and the food provision options until our schools get settled, primarily because they do rely on parent volunteers. And at the moment, we one of the challenges we have is that we're not having parents and people who aren't on our staff in the school. So I think we'd like to get past September and then look at how things have settled. And I think we'll be in a lot better place to more fully address all the questions and issues around specifically things like food, food fundraisers and hot lunch programs in schools that parents are using as fundraisers. And again, this is not the same as the food we're providing to students who need food in our schools. That is continuing.
Okay, so that the food that is being provided in schools already is in that document, but you're asking schools to hold on things like hot lunch fundraisers.
Just until schools get settled, yes.
Okay. And just one final slide here with regards to, and this is both to the VSB and the trustees, with regards to the long-range facilities plan.
Thank you, Gord. I don't think I've been to a DPAC meeting where I haven't had a question about the LRFP, so I'm pleased that it's here. Yes, I think one of the big things that we have seen during the pandemic that's been highlighted is the concerns that we already had around area standards. So we knew that they were already an issue. We have been advocating to the ministry that we feel they need to be changed, as has the British Columbia School Trustees Association, so on a provincial level. And I think what this has taught us is that we do need more flexibility in our facilities. So we will continue to advocate on this item because it's an issue when we aren't in a pandemic, but it's even greater issue when we are. So that is one specific area of the LRFP that we can work with. And as the chair of the advocacy committee, I can work with stakeholders to do some work around that.
Okay, thank you. So at this time, we're at the end of our questions. I know that Suzanne would like to say a few words, and then I'll say a few words about any questions that have been submitted while we've been doing the presentation. But for the moment, just over to you, Suzanne.
Thank you. Thanks, Gord. And thank you to your team again for the support that you have been providing to the senior team with feedback as we work through this very complex and complicated times, ensuring that we provide educational programming and whilst taking care of the health and safety of your children. Gordon and Amanda, you've done a great job, and we very much appreciate all that you have been doing. And to parents that are on the call, thank you for listening and for sending the questions in advance. Obviously, this is a work in progress that is continuing to evolve, and we are committed to continuing to work with you as parents and alongside you to do the work that needs doing and to ensure that we take good care of your children and the programs that they need to continue their educational journey. So we don't have all of the answers here tonight, but we are committed to continuing to clarify and work through all of the challenges that we have. So thank you, Gordon.
Thank you. So I just wanted to just kind of address kind of some comments in the chat. And yes, please do. We have opened up our forum to receive questions that may have come up during the chat. And if you need to resubmit a question because you don't feel it was answered, please do resubmit it. Again, we're going to try to collect all of them. And if there's a theme to some of the questions, we'll try to get some of those answered at our upcoming exec meeting. I do want to, reiterate that we received, 150 or slightly more questions, and trying to condense them down into a couple of hours is actually quite a feat. There's a lot of information here, and if we didn't address your point directly, again, I apologize. There is a lot here. Our upcoming exec, so thank you very much to everybody for your time. The exec meeting that we're going to try to get the condensed questions answered for is on September the 10th. And that's our first exec meeting of the year. And then I've provided kind of a schedule of upcoming dates and events, including the school orientation, first day of school, which I'm sure that all of us are very, very aware of, and some of the first VSB meetings. So again, please, if we haven't answered your question directly, please do submit them through the form again, and we'll try to condense them again and have them addressed in the executive meeting on the 10th. Again, thank you very much for staff time. It's 2 hours on a Wednesday night. Thank you very much to parents for being here. I know that you're really concerned about this school year, concerned and excited and nervous. And I do recognize that. So I know you're here for the very best reasons. Thank you very much, everybody.